Good afternoon, everyone, and welcome to today's call. Dr. Morse, if you're ready to start, I have already pressed record, so we're good to go.
Okay. We'll go ahead and get started, and I'll just... Can you hear me okay, Janine?
Yes, I can hear you, and I'm just looking for those that are unmuted. I can mute them.
Okay, no problem. I just wanted to make sure. All right. So I have a wide variety of data and things to share today. So just as a general message, I'm not planning to really discuss the vaccine today, just because that would take up a long time. I am in the process of recording some educational short videos for anyone who needs them or wants to view them in the community. I already have done one that it's just a 12-minute video that covers the research development, approval, and safety monitoring process of the vaccines. That's already on the 3 health department websites. So if you're interested in that, I'm going to be doing ones that cover just questions and answers and just general information about each of the vaccines, and I'll get those done as soon as I can. We really don't know, when educators will be vaccinated, how that's going to happen in each area, but you can rest assured, as soon as we do know, you'll know. So just hang tight. There is more information at michigan.gov/COVID vaccine, and there are documents on there about the prioritization groups and things. And then there's a lot more information at the CDC coronavirus website. There is a tab for vaccines, and there's a lot of information there, and it keeps being added to on a regular basis. So just hold tight on us with that. This is just some suggested content for messaging if you would like to use it. And, if you would like to use it saying that this is what the health department said, I'm okay with that. But basically to your students and staff, as they're returning back after the holiday break, to let them know that if they have any symptoms of COVID, to not return after the break and to get tested as soon as they can. And then a reminder that they can go to the michigan.gov/coronavirus test. And it's a great site. They can just click in, if they need one that's free, if they need one that does not require a doctor's order, they can select those things. You can also select if they need one that'll do asymptomatic testing and things like that. And for those who don't have access, you can call 211 and they'll do the same thing for them. To message before the break that, it's not recommended to travel or to have gatherings over the break. And if they do decide to do that anyways, that they should consider getting tested 5 to 7 days after they return from travel, or after they are in a large gathering. And the travel recommendations are at the site listed there at the CDC, and that does discuss the testing suggestions there. Encourage people that if they have not yet gotten their flu shot to do so ASAP, and to consider talking with their healthcare provider or the health department about any other vaccines they may not be up to date on. There are a couple of nice PDFs from the CDC that review all of these things and give some good guidance about safe holiday celebrations. I just want to share an interesting study that has, trying to share my screen a little differently here, and I don't know that it's working. Okay, so a new study that just recently came out, and I'll go over the data here a little more specifically, but it was done in Mississippi and found that kids under 18 that tested positive for COVID were not more likely to have gone to childcare or to in-person school, but were more likely to have gone to gatherings like weddings or parties or funerals prior to becoming positive. the website where the study is at is listed here. The specifics of this is basically they did a case control study. Their cases were kids under 18 that tested positive. The control were the kids that tested negative. And they had almost 400 kids and adolescents that were in this study between September and November. And so they looked at kids that, again, tested positive. And in the 14 days prior to their test, of those kids that were positive, 62% of them had been in-person school or childcare. 68% of those that were negative had been in-person school or childcare. So basically, it's essentially the same amount. And the parents, when they were questioned, of those kids that were positive, they said 64% of them said that their child and all the staff members at those schools were compliant with wearing masks. Of the kids that tested negative, they said that 76% of those parents said that the school staff and kids were compliant with masking. In the 2 weeks prior to testing, those that were positive were more likely to have had close contact with someone with known COVID, to have had gatherings in their homes, and to have had visitors in their homes. So this is a little easier to visualize it. This is the odds ratio. So when you look at a table like this, if it's an odds ratio of 2, that means you're 2 times more likely. If it's an odds ratio down here of 0.5, it means you're half as likely to have done that. So like here, if the child were inside of school prior to their testing, they were half as likely. So this has to do with those who tested positive. Those who tested positive were half as likely to have been masked. So you can just see basically if it's on this right side, it increased your risks of testing positive. If it's on this left side, it decreased your risks of testing positive. So I think I misspoke here. This is where the kids and the staff wore masks, so it decreased your risks of testing positive. So I just wanted to share that it was just additional data kind of showing that being in person school or in childcare in this situation did not seem to increase the risks of testing positive for COVID when kids presented for evaluation of symptoms. I just wanted to share this as well. Michigan has just started a Mask Up, Mask Right, well, continues to have a Mask Up, Mask Right campaign. They just released this graphic. They have here that the right things to wear are a 3-layered cloth mask, a 3-layered medical grade mask, or an approved KN95, which is similar to an N95, but not as heavily sought after. They listed here that neck gaiters are not right. I just wanted to point this out in case questions come up from this. The CDC has stated to not use surgical masks or any kind of medical grade face mask because of the need to reserve those for healthcare workers. But you can use non-medical face masks. And the CDC states 2 to 3 layers is acceptable, and neck gaiters that are 2 layers or folded over to make 2 layers is acceptable. I'm not going to split hairs. I just wanted to point out that there is a difference in recommendations here, so that if this comes up, you are aware of it. I personally feel you can follow whichever works best for you. You know, I think we've talked before. I think if you have students that all they have is a neck gaiter, have them wear a neck gaiter and have them folded over. But I just wanted to point this out in case that becomes an issue for you. I just wanted to review the quarantine. This is what we discussed last week. You can reduce it to 10 days if they can continue to monitor for symptoms for the full 14 days. If you have any concerns about that, or you just prefer to continue with 14-day quarantine, that's completely acceptable. The caveat here is that may conflict with Public Act 238 or MIOSHA recommendations for your employees. And so as an employer, you need to refer to those sources and determine what is appropriate for your employees. Last week, I talked about the thought of doing a joint press release between the health department and the schools to promote community vaccination as a way to help keep the kids in school. I've heard back from one additional school district, in addition to the West Shore, who kind of helped spur this idea in the first place. So we'll probably do this early next year. So if any more of you want to join on, just shoot me an email and let me know, and I'll add you to the list. We decided to not provide, I have been providing a table with what we think our school counts are. They've been getting to be harder and harder for us to keep up to date. And we've been noticing our data is not completely correct. And it's not any fault of the school. It's just us keeping correct counts and keeping them up to date at the point of these talks. So we decided not to share that any longer. My goal with doing that all along was just to try to illustrate really the lack of spread of illness within our schools. But I think we can really do that with the data available at a state level. But again, I just wanted to let you know why those tables are not in here anymore. The report with some state analysis was just released, and I did pull some tables. There's some additional information that I was able to pull as well. But this black line is what the US has been doing. This purple line is what Europe has been doing. But the US has seen this bump since Thanksgiving. Michigan, however, has not. So this black line, we seem to have hit those restrictions just in time. Our black line is our actual case counts. We have continued to trend downward. So we seem to have avoided that jump after Thanksgiving. These other lines were some modeling estimates that were done prior to Thanksgiving of what could have happened. So it seems like we're following this purple line. Hopefully that will continue. So it's hard to know what's going to happen after New Year's and Christmas. And we don't know what's going to happen with the epidemic order. Obviously, if that changes drastically and things are really opened up, we could see another big jump. But so far, things seem to have gone quite well for us compared to the US as a whole. So this is more specific, just a little closer look at it. These are our case counts. These gray bars are our actual daily counts for Michigan, and the solid line is the rolling 7-day average. So looking a lot better than it was. This is a lot more just crammed together. This top one is our daily counts per million. Middle one is our hospitalization rates, still kind of leveling off. And the bottom one is our percent positivity. Over on the right, it crams that all together for our different regions. So we have counties on this call from these 4 regions here. I know this is a lot of information shoved into this, but we will send these slides out. But our hospitalization rates go anywhere from the 25% down to 13%, and the percent positivity anywhere from 14% down to about 10%. Over in this Region 3, though, you have to keep in mind that this includes Saginaw and Flint area. So that really throws that. I can guarantee you the hospitalization rate for Gladwin and Aranac, which is the two counties we have in this region, are not that high. So our testing turnaround time, if you take into account time for the test to be run and the shipping to the lab, is up to about 5 days right now for commercial labs. If you're in a hospital, it's right around 2.5 to 3 days. So it's about the same to a bit higher right now, or a bit longer. To look up every lab in Michigan, you can go to the state website. It's on the data page. The number of outbreaks, I threw in last week's K through 12 outbreaks. So last week we had 34 active outbreaks in Michigan. Right now we have 25. And then in terms of ongoing, that has come down as well. I've noticed it seems like some of the ongoing outbreaks just don't seem to come off of that list, so I have a feeling it's much lower than that. But we've definitely had a drop in the number of outbreaks. I do suspect that there are probably, in our bigger counties, more K through 8 schools that are remote only at this time. This is this past week, and then down below I put the week prior, just so you could compare. This is the split of cases, the number of individual people involved in outbreaks. The blue is the ones that are new from the prior week. So you'll notice, we still do have high school students that are being reported as being in an outbreak. That to me is probably an error, unless they somehow have been involved with like special education or something. But, obviously a tremendous decrease. There are still ongoing outbreaks from the high school, and that usually is, if these are correctly reported, it's ongoing transmission. You can see that the largest outbreak in a high school setting has been 79 people have been involved. So again, those have just continued to spread in those age groups. In elementary, it's been about the same number, and junior high has decreased from 25 cases to 18 cases, and that's statewide. So that's throughout the entire state. This is our trends with hospitalizations. Again, we're regions 3, 6, 7, and 1. So stable or dropping. And then this was something we went over last week and the week before, in terms of getting to investigation statewide. The week prior, we were at 20%. Then last week, it was 25%. This past week, our case investigators statewide have been able to get to 36% of cases and fully investigate them. I know we're at that, and we kind of bounce between about 20 to 70% depending on our load. So we are getting to more cases. The amount of people that are already in quarantine and that know where they're getting COVID from has stayed pretty stable. Obviously, if we're investigating more of our cases, that's a little bit higher absolute number, but things are getting a bit more manageable now. And the state has just onboarded a new system where we're going to be able to text individuals with COVID and send them a questionnaire they can do online. So that should be going live relatively soon, so that should help as well. This is just an interesting projection that looks at kind of our Midwestern states. So if things stay the same in how our behavior is, the average cases for Michigan, which is this greenish teal line, they project us to come down like so. And then for our average deaths, they expect us to continue to plateau. So again, I just wanted to share, a promising trend there. For our individual counties, for the counties of Central Michigan District Health Department, you can see that they've all been decreasing for 3 to 4 weeks or more in terms of case counts, and they've all decreased in their percent positivity over the last week. The average has decreased over the last week for both cases and percent positivity.
Sorry to interrupt.
Oh, hi.
PowerPoint screen still instead of the.
Oh, I'm sorry. Thanks, Jacqueline. Yeah. I'm trying to be all high tech and just share one thing instead of my whole screen. So, all right. There. Okay, so if you can't see that now, just let me know. So anyways, so all these numbers have been decreasing. They're still, higher than we'd like to see them, but they are decreasing. District 10, all of our counties have been decreasing as well. Some of our percent positivities have not gone down for certain counties, but still everything seems to be going in the right trend, and everything's been decreasing for mid-Michigan as well. I pulled some tables. So these graphics I just discovered today that I'm able to make from our data source. They're a little bit busy, and I'm not going to spend a lot of time on them, but I just wanted you to be able to visualize those numbers. So these are all for the past 3 months. These are our Central Michigan district counties. These are the daily cases per million. Again, I know it's all kind of crammed together, but you can see that we went up, but we are all going back down again. This is the percent positivity of our test results. Same thing, up and down. With District 10, I split it into 2 sections because there are so many counties there. So this is Crawford, Kalkaska, Mecosta, Newaygo, and Oceana. Up and then down with our cases. So everything is trending back down. We've had some up and downs, but so far everything seems to be on the downward path. And then the percent positivity, same thing. Things do seem to have peaked and do seem to be heading back down. There are, some little blips, but overall a positive, I shouldn't say a positive trend, an optimistic trend. And then this is Lake, Manistee, Mason, Missaukee, and Wexford. So there's a lot of variability here, but they're overall, for these counties, they do fluctuate a bit more because their total numbers are pretty small and their population's a bit smaller for some of them. So again, still up and then down. So downward trend, positivity rate, downward trend. Missaukie's had some different fluctuations. Again, some of these counties, the amount of testing they're doing will fluctuate quite a bit. For Mid-Michigan District, the daily cases, oh, I apologize. I had it set for 3 months, and for some reason, oh no, I did pull it for 3 months. All right, so up and down on the downward trend, and then for the percent positivity, same thing. So, again, we're not anywhere near out of the woods at this point, but just optimistic trends at this point. The final thing I wanted to share with you, I will get this out to you. Last week, we had talked about some of the things I was thinking of putting into a decision-making tool. I did get it finalized. I have shared it with some colleagues, got feedback, made edits. But I did finalize this decision-making tool that you can go through yourselves or with your school board when you are making decisions about whether you should be in person or remote. This is a little hard to read, but just some points on here. This is not a specific scoring system. It's just a tool. The more no answers you get, then the more consideration you should put towards going to virtual education. You would want to pick the best answer. So some of these won't be a definite yes or no. A yes might mean that most of the time or mostly yes. To answer these questions, you'll use the information that I present to you on our Thursday calls. You may go to the Michigan.gov coronavirus page for data. You might go to the MyStartMap page for data, things like that. So basically, it works you through these questions. For the sake of time, I'm not going to read through all of them, but we will send it out with the slides and the data like we usually send out each week. If for any reason you don't get those emails, we should have a point person that we send this to for every school. But if there's still an issue and you're not getting it, let me or someone at the health department know. And just, you can edit this. This is not something set in stone. This is a tool for you. I did put blanks in here for you to add any non-public health factor. So if you wanted to add in there, do you have enough teachers? Yes or no? Do you have enough substitutes available? Do we have enough janitorial staff? Do we have enough bus drivers? Things like that. You can add that in there too. So, so again, I will get this out to you, and hopefully that will help you along the way. Finally, I just wanted to wish all of you happy holidays, and hopefully everyone stays happy, healthy, and safe. I know the question will come up about what do we do after January? Should we be closed for 10 to 14 days? There is no great answer to that. I think we've seen that we really have not had the spike in cases after Thanksgiving. I don't believe in our schools we've really seen the big spike in cases or outbreaks. And so my inkling would be wait and see what happens. You can always close if you have to once school comes back. If you or your staff are uncomfortable with that, do what's best for your school district. But hopefully we can all get a little bit of rest and relaxation over the next time period. Our health department offices are closed from the 24th until whatever day that is. I think the 2nd we come back, but we're always available. So if you have questions.
The 4th, Doc.
The 4th?
Yep.
Okay, the 4th. So, but whoever you call normally, we're all going to still answer our phones and our email. So with that, I will conclude my presentation and we'll open it up to questions.
All right, I will start with question 1. The health department's new guidelines put out on December 15th reference that 3 layered medical grade masks or 3 washable cloth masks are to be worn. The ones that we have in stock are 2 layered non-medical. Is this a recommendation or required in order to go back to school?
So I think my one slide covered that. The recommendations for the 3 layered came out from MDHHS. I think if you have 2 layer in supply, use those. I would, if you have people with higher risks, you may want to use the 3 layer if you have them, but kind of the gold standard is 3 layer, but use what you have. It's not a requirement. Those are recommendations.
Okay, next question. If someone travels out of the area, example Florida, over the break, are we leaving it up to them to follow the guidelines to stay home for 5 to 7 days and then test? Does the mode of travel make any difference in whether they should quarantine after travel?
So that will be kind of a school policy decision. The recommendations are as spelled out on the CDC website. It's very difficult because you are going to have people traveling who will never tell you. And so if you have any kind of a policy, it'll be tricky to enforce it. So, but none of it is officially like a rule. It's all recommendations on the CDC website. So again, I think it's good to encourage that, but to not allow people to come back to school, that kind of thing, I think would be extremely difficult for you to enforce and follow.
All right, moving on. What advice do you have for the following scenario and in working with parents to help them understand the importance of following protocols? A parent tests positive for COVID-19. Their child is symptomatic and is tested for COVID-19. Prior to receiving the child's test results, the child is sent to school. The health department notifies the district that the child is positive and in school. Yes, this really happened.
So if you know that the parent's positive or you know that the child has symptoms, then you need to send the child home. I think just continual reminders to the parents that if your child has symptoms, don't send them to school. If your child is getting tested, it has symptoms, do not send them to school. If you have continual reminders to your teachers, if you notice a kid has symptoms, send them to the nurse so the nurse can call the parents and have them be taken home. I think it's just, this has been going on long enough that we just kind of forget those things. But yeah, I know those things happen. I think it's just a matter of really reminding everybody that this is how we need to do this. And it might be a good time when the break ends to really remind people that, if someone's sick, stay home. If you notice someone is sick at school, send them home. If you're waiting for test results, stay home, things like that. But that's the best that you can do, is just keep really drilling at home.
Dr. Morse, are there any civil penalties for a parent who would maliciously or with intention purposefully send kids to school like this that you're aware of?
I don't know. I don't know that kind of thing. I do know, there are some verbiage for employee-employer issues, but I have no idea when it comes to the school system. So that would be something you'd need to ask your counsel.
Okay. Frustration is this family is now left school and is now posting pictures of them in Grand Rapids at a hotel swimming in a pool while they're all positive. So frustration to deal with.
If you know someone is positive and contagious, and you know where they're at, you can let us know and we'll hunt them down. And if they're in Grand Rapids, we'll call the Grand Rapids Health Department and we'll hunt them down. And we'll call the hotel and tell them that they have people that are positive, because that's a threat to health and public safety. So that's a little different.
Okay. Well, that's what we've been dealing with, is we believe that this is very much intentional. The parents both were positive. The child, from what I understand, was symptomatic on Wednesday of this week, got tested, but then sent the child to school today. And of course, we're notified that the child is in school and is positive. And so we're having to put all the protocols in place, send kids home in the middle of the day, and then have to do the contact tracing all the way back to Monday, 2 days prior to the symptoms. And it has been a complete nightmare for us. And then to have the elementary principal send me a picture of a Facebook post of them now checking into a hotel swimming in a pool in Grand Rapids has infuriated me. So I just want to know what kind of protocols we can follow to ensure that parents who do so intentionally with malice, that there's a recall or some type of something that we can do because it's been a frustration for us today here in dealing with this.
Yeah. But yeah, if you know someone is violating their isolation or quarantine, let us know. And again, with that situation, I mean, they're exposing a hotel, and I know Grand Rapids Health Department would want to know about it. So feel free, if you want to call me after the meeting and give me information, we can work on it.
Okay, thank you.
Yep.
Okay, next question for clarification. 34 outbreaks in K-12 school buildings for the reporting period of 12/10.
Let me go back to that slide. So for the week ending December 10th, there were 25 new outbreaks in K through 12. There were, in terms of the number of individual people involved, there were 68 people involved in elementary school, 18 people involved in junior high, 14 people involved in high school, 14 administrative people involved. So there were 114 total people involved in the 25 new outbreaks for the week ending in December 10th. In Michigan, in the whole state.
Okay. Next question. What do you think has contributed to the decrease in cases?
I really do believe that the stay-at-home orders have, it's not stay-at-home orders, the decreasing socialization, the epidemic order has been the main factor. I mean, the biggest issue for spread is people getting together, and if you decrease that, and I didn't share these slides, but there were slides available using mobility trackers. There's, Google Maps has data like that shows how mobile we are, but that we really have been congregating less and less mobile. So the less you're exposed to people, the less likely disease will spread.
All right, moving on. My assumption is that once an individual has completed both courses/phases of the vaccine, will they no longer need to quarantine due to close contact? Is that correct?
No. Once you're vaccinated, everything stays the same until we know what's happening. So once enough people get vaccinated that we know things are under control, then we'll be able to start backing off. But at first, we don't know how much control it's going to give us. So even if it's 90% effective, if we have a very small percentage of people vaccinated, that 1 in 10 chance could still be enough to infect you. So we still need to use all of our normal precautions until we get enough people vaccinated that it's going to allow us to start backing off on things.
Okay, next question. Early on, we discussed a 3-day quarantine on books, traveling back and forth from school to home and vice versa. With more emphasis on oral transmission of the virus, less on physical contact, is the 3-day quarantine still the recommended time frame for these items going back and forth? Also, at what temperature does the virus die where we can stop disinfecting outside surfaces?
So I haven't seen any updates to that data. I haven't specifically looked for it though, but I have not seen any changes. And I have seen publications still stating the 3 to 5 days on surfaces. I know environmentally, it actually seems to transmit better in cold, low humidity weather than in hot, humid weather. So there's no, I mean, freezing doesn't necessarily kill it, and you'd have to get to quite high temperatures. I mean, you're not going to get a book to a high enough temperature to kill the virus. So basically, winter time is not going to stop the necessity to sterilize or to disinfect things.
All right, moving on. Is there a way to verify if a student should be in quarantine? How can schools verify information about close contacts and positive cases? Is there any enforcement or repercussions for families not following quarantine, like getting together with friends outside of school? We can't tell that the other family about the child's quarantine status. Should this be reported somewhere? There's a lot of questions in there.
Yeah. So if you are if you've heard rumors that, hey, this kiddo should be in quarantine because their dad is positive, something like that, give us a call and we can look it up. We were trying to notify you of all the kids we knew of who could be in quarantine. The issue is that we don't always know right now just because we haven't been necessarily able to investigate every single case. But we can look it up if we need to. Again, if you know people are violating quarantine or isolation, let us know and we'll do our best to educate. You know, legally, the amount of time it would take us to legally enforce the quarantine or isolation, their isolation or quarantine would be over by then. But if there's any issues, let us know, and that's what we do. That's our job.
All right. Next question. Sorry if you answered these prior to me getting online. Should people who have already had COVID-19 get the vaccine? If yes, how soon after having had it? When will school staff be offered the vaccine and where will they be getting it?
So yes, they should get the vaccine if they've already had COVID. If they're acutely ill with COVID, they should wait until they recovered and they're out of their isolation period. We don't really know right now when we'll start vaccinating school people, but you will be the first to know when we know.
All right. Next question. So to clarify your opinion as to what contributed to the decrease in cases, are you saying closing high school students to face-to-face made a significant difference, or just closing bars and restaurants, theaters, etc., or a combination of things?
It's hard to suss out what it was. I think probably the biggest impact, and I mean, I'm welcome to any other health department person who might want to jump on this, but I think closing bars, bowling alleys, restaurants, the larger congregate type activities like that likely had the biggest impact, plus really encouraging people to not gather had the absolute biggest impact. What impact closing high schools had, I'm not sure. I can't really say. I mean, you can see that the number of high schoolers involved in outbreaks has decreased, but I mean, it's not been that big of a decrease. So I can't really comment on that. I do think, though, the biggest impact was from the other non-essential services that have been paused.
All right, you're getting some thanks also for your work, your leadership, and to the staff for keeping the community safe. Dave is asking again, do you have any insight on the extension of the pause?
Not a bit. And I don't, well, I'll speak for my health officers and say they don't probably have any hints either. Certainly they can speak up if they want, but usually at best, they might get a hint like just before the governor announces it. So.
Hi, this is Marcus, and I will say the following, though. It's not like we're being kept in the dark. We meet regularly with both MDHHS and with the governor's office, and they are very attentive to our concerns. And so anything you want us to relay to them, please communicate that to us. As a elected official, the governor cannot obviously telegraph her intentions because outrage would ensue and it would be blocked pretty much no matter what she telegraphed to the public, because there would be some constituency that would hate it. So she just can't function if she telegraphs her plans. But they really care about what you think, and they ask us every week what you think. So please tell us.
And if you go to the epidemic orders, there literally is a comment email in the epidemic orders. At the very bottom of the order, it asks for comments and concerns, and there's an email there. So if you do have any comments or concerns, you know, they're actively being solicited.
Are there any other questions anybody has that they'd like to share? Put in the chat box or unmute yourself to ask.
I just want to save me some typing, Dr. Morse. So with the current data, and again, you're wonderful. I appreciate the data you provide us. Minus the mandated pause, let's say that wasn't in play. Again, I'm going to make an assumption that you would have no problem with schools being fully face-to-face based on our local data.
Right. I would not. I would be a bit nervous about, I know everyone argues about sports. I'd be a little nervous about that, but I know that there's concerns about other sports happening outside of school, and I know there's argument about that, but so that's just one place I have pause is just because, you know, we did see activity with spread in those conditions, but I would not have any problem with restarting all education at this time, depending on your localized situation. You know, I have some areas where the local case rates and spread have been much higher. So, so again, that decision-making tool that I'll share with you, I think kind of walks you through all those decisions pretty well. And so, you know, just like always, it's, if you're not seeing spread within your schools and you feel like you're doing and able to do a good job with detecting your cases and following up on them, I don't see why you can't have in-person education.
Thank you.
All right, Dr. Jason Jeffrey added the comment to please ask Dr. Caldoon to consider refraining from generalizing during press conferences with data. Dr. Jeffrey, I don't know if you wanted to hop on and elaborate there.
Yeah, sure. Happy to elaborate. It's tough sometimes when numbers are thrown out that are statewide numbers. I think during one of the press conferences we heard that, you know, the figure 200 or something around 200 was thrown out in terms of school outbreaks. And I think sometimes when our staff hear numbers like that, it really increases anxiety because there's not a general realization that we've got about 3,550 schools in this state. And so, you throw the number 200 out there, and that's really less than 6%. And so those generalizations, I think, cause extra work for us in district leadership, because then we have to act to reduce that anxiety. So it was just a thought, and when Mark threw that out there that we could ask them to relay information, I wanted to take full advantage of it. Thank you.
I think the other thing is that most of those outbreaks are tiny. They might be 2 or 3 people, which really means that one person gave it to 1 or 2 other people. And I think that's where it's hard to really impress that upon people when you say, oh, there's 200 outbreaks. Like, well, yeah, but that might have been like one person giving it to one other person. And it's really challenging to communicate risk like that.
Any other questions or comments on the call?
Thank you, and Merry Christmas.
So Dr. Morse, next week is Christmas. I assume we're not having a call next week or the week after that. Is that true, or are we moving this meeting to a different date during that time period?
Well, I did not plan on meeting. I figured if everyone's okay with it, I know I could use a little break for the next couple weeks. And like I said, we're actually closed. So if it's the pleasure of the group, and I know you guys are likely on break, even though none of us are probably really ever on break. My hope was to not meet next Thursday or the Thursday after, but to then meet on the 7th. I know we have some requests. I see one here for the 4th, but yeah, I'd rather if we could meet on the 7th just as normal, because I think when we try to change the meeting day and time, it causes some struggles in terms of just communicating it. But again, I'll be available by phone and email over the next couple of weeks if you need anything. And if anything comes up that needs to be communicated with you, we will get it out to you. And I mean, I'm hoping there won't be any earth-shattering news that can't wait a couple of weeks. So with that in mind, we'll meet again on the 7th. You can contact me if you have questions, and I'll contact you if we have major updates that can't wait.
Everybody have a wonderful, restful, safe, and healthy holiday.
Thank you.
Get rest, everybody.